This is Dr. Marty Harris, and today we will talk about knowing the student with physical disabilities and/or other health impairments. The key word to think about when working with these students is individuality. Remember not to generalize and think that all students with epilepsy will be the same, that all students with cerebral palsy will be the same. It just isn't true. Look for their individual gifts, talents, learning, and behavioral patterns to ensure their success. First of all, to get to know these students, we do need to get to know their parents and families. There can be a tremendous impact upon the family depending upon the nature and the degree of the disability. Let's look at some of the impact factors. Daily routine may be complex and time-demanding. Families may need respite care so the family has breaks. Reoccurring medical crises, ongoing medical bills, cost of replacing assistive devices. Any and all of these factors can wear a family down. We have already discussed the bell curve IQs and students with physical and/or health disabilities. Next, let's think about the impact of physical and health disabilities on the student's intellectual functioning. Children with physical and health impairments may have difficulty in one or more of the components of intellectual processing. Consider health impairments. If a student has difficulty with fatigue and stamina, they may have difficulty with input, processing, and output. A student with cerebral palsy may have difficulty with output, but no problems with input and processing. The important thing to remember is that intellectual functioning is very individualized. There are 3 critical areas that impact the student's learning and behavior. Limited functioning due to limited strength, vitality, and alertness. Let's look at how their function is affected. Motor limitations, restricted communication, fatigue and endurance limitations, health factors, experiential deficits, lack of exposure to different experiences, lack of ability to explore their environment, learning issues, and additional impairments such as vision and hearing. Psychosocial factors are also influenced by the very nature of their physical and health disabilities. These problems may include social problems, communication difficulties, a small circle of friends, low self-concept and self-esteem, motivational problems such as learned helplessness, lack of emotional resilience, poor social competence, lack of self-advocacy competencies, limited understanding of social situations and appropriate responses. Planning educational services and the decision-making process. As with all children with disabilities, we need to be very serious and very careful in planning for their educational success. This includes the IEP, goals and objectives, placement and least restrictive environment decisions, related services, assistive technology, and transition planning. These decisions are based upon the functional assessment, which addresses communication, achievement, socialization, motivation, Parent and family expectations and preferences. Finally, we should look at the presence of any additional disabilities and plan for those. Educational programming. Within the IEP and the IHCP, we must specify healthcare procedures and services administered by school personnel and a plan for emergencies. One of the most important things for all educators to know concerning emergencies is the correct response to seizures. See your textbook for details concerning seizures. Additionally, with each student, you need to work with the families and the healthcare experts on how to respond. Ask a lot of questions. Keep a written response plan in a very accessible place in your classroom. Perhaps the inside of a cabinet door that is not locked. This is good advice for other conditions and other students. For example, a list of tips for effective teaching of a student with sickle cell anemia could be placed in a convenient location for you and for the substitute teachers. Remember to respect and follow the confidentiality rules of your district. Ongoing communication with parents and families of the student with physical and health disabilities is the key to success. Let's look at 5 instructional guidelines. Classroom adaptations. Arrange for easy access. Give the student breaks. Collaborate with other professionals. Material adaptations. Shorten the assignments. Extend the time. Use specific modifications that are developed by you and others that know the student well. Teach essential skills. Self-advocacy, self-monitoring, and health management. Effective teaching strategies include monitoring, communication with the parents, communication with other professionals, and finally, plans to address absences. A plan to address the absences is very important for students with physical or health disabilities. For example, asthma, the leading cause of absenteeism, is on the rise and affects over 5 million children, some 8 to 12% of the students in school. Just sending home assignments may not be enough to ensure progress. Work with the families to ensure continued services during absences and hospitalization. Technology can be extremely important for the students with physical and health disabilities. For example, augmentative and alternative communication devices, computers that are voice activated or have adaptive equipment, prosthetics. Teachers need to become familiar with such devices by working with parents and health experts. Medical treatments which involve advanced technologies may be given in a school setting by trained health care providers. Test accommodations or alternative assessment. We have talked about this subject before in this course, but right now let's think about this for students with physical and health disabilities. Accommodations in state and district testing should be written into the IEP, such as changes in test delivery, materials, or presentation adjustments. Test delivery might include something such as breaks, different test schedule, or extended time. Materials might be something like enlarged print or braille. Presentation adjustments may include someone to read directions or record answers. The IEP team may determine that alternative assessment is needed, such as videotaping or portfolio assessment. Alternative assessment of progress. If the IEP team determines the student should take an alternative assessment, then the IEP must include 3 things. 1. A statement of why the child cannot participate in the regular assessment. 2. An explanation of why the selected alternative assessment is appropriate for the student. 3. A description of benchmarks or short-term objectives that are aligned with the alternative achievement standards. As professionals, it is our job to help these students be full citizens in our classrooms. Value their talents and see them as individuals. That way you can ensure that their education is special. Thanks for listening.